This is objective structured clinical examination. Means what? Objective structured. Before examination, we'll make arrangement. What type of arrangement? This is as per suggestion of CBSE. What? Say we are 4. We'll make 4 stations. We'll make 4 stations. And all the stations will be having patients. One patient here, one patient is having, all are having one patient. Now one student will be coming. And he will take the history of the patient, he will examining the patient. We are here, will be just observing you. And we have got the 3 things to be assessed. So we will be rating you. I may have, I don't like this boy. So what I will be doing? I will be giving less mark. But he is having good rapport with that boy. So after that, from here, he will be shifting to another station. Again, he has to perform the same thing. Now he is having a good relation with you, so he will not deprive you. He will not deprive you. Okay? Then he will be going to another station. He is an external examiner. Maybe. Maybe now. One external examiner will be there. What? We are internal examiners. Okay, I have seen her for 1 year long. Okay, not good. Okay, then even then I am giving this much mark. But external examiner, he will judge you correctly. So he will judge you, and again the another person will judge you. So if there are 3 examiners, 3 person will be examined. 3 stations will be there. So no way. You have to learn all these things. If you plan, I have to satisfy sir. So making good relation with me, so that is not going to help. You have to make good relations by what? Not personal relation.
Skills.
By your skill, by your qualities. How he is. Their individual difference will be there. You will be dealing with one patient, you see, observe it. He may be dealing with the patient in different way. So you also observe that. However, all of them will be following the required protocol. So now, today, how to take history of the patients. Okay, so let's go ahead.
So today we are going to see how should we approach to a patient. If a patient comes to us, what are the first things which has to be taken care of? How should we approach him? So firstly, listen. Firstly, you should look confident. Only then the patient will describe his problems. He will tell everything to you, his name and everything else. Firstly, you should welcome the patient, saying hello. You should tell him to sit down, to relax. Then we should shake hand in hand with the patient. Or sometimes just saying hello is enough. Or greeting him, telling him to sit down. These things are enough. Then you will introduce yourself first. That I am this doctor or this medical student. My name is this. I came from this college. Or the patient might be knowing that you are in this hospital only. So firstly, you will introduce yourself. Then you will firstly tell the patient what you are going to do with the patient. You will explain that I am going to ask you some questions regarding your condition. So you should first relax the patient and then you should describe the patient that what I am going to do with you, so that the patient knows everything beforehand. Otherwise the patient might be anxious, he might be frightened that what is going to do next. So you must explain him that I am going to examine you, or I am going to take your history, I am going to ask you these questions, you will answer me properly. Then make sure the patient is comfortable and curtains are in place. So in OPD, we are seeing one patient each. In a hospital setting, like if in a multi-specialty hospital, there might be 30 beds, 20 beds at one place. So obviously, if you are talking with one patient and others are seeing that, okay, he is examining him, he is telling his private things, personal things to him, obviously he cannot tell it to you. Na? So we will put curtains so that the privacy is maintained. And in case of opposite gender, like if any male doctor is examining a female doctor or asking questions to a female doctor, or a female doctor is doing the same, in a female patient, and if the doctor is female and the patient is male, in that case also, you will pull the curtains. You will, in case of female staff and in case of opposite gender, especially in case of female staff, if a male is examining or male is questioning, you will bring their home member, some relative must be present there, and even if some relative is not present there, the relative must be of same gender, must be female. There must be a female relative, so that there can be no wrong allegations or accusations against you. So you might be doing good to the patient, but the patient may sometimes accuse you that he did something wrong. So there must be a proof that you are not doing anything wrong. So you must have a relative or at least a female staff along with the patient. Don't talk. Then the curtains must be in place. Then we will start asking. Firstly, we will ask the particulars of the patient. Then after introducing myself or the doctor after introducing himself or herself, then we will start asking the patient that what is your name. Then what is the importance of name? We can call someone like this also. Okay, you come here, you sit here. So the person will not feel validated. He may think that okay, he is treating me like any other person only. He doesn't even know my name. So obviously, in this way, if you call someone by his name, if I know her by her name, or if I know someone by his name, so obviously that person will feel that, okay, the doctor knows me at least. Then he is taking care of me. Then you should use the patient's name, you should know the name. Then the age. Age is important because in some age groups, there are some diseases which are prevalent in some age groups. Like there are 3 age groups. One is for children, one is below 18 years. So that age group will have a different set of diseases from the adults and from the geriatric age, which means the old people or the elderly people, they will have more inclinations towards some diseases, and the adults will have some kind of diseases. So the age is important to know that below 40 there must be some there will be less prevalence of diabetes and hypertension and these things. If the patient is of 60 or 70 years, obviously the patient may have more inclination to have diabetes or hypertension or such age-related diseases. So the age is important. Next comes gender. Some diseases are gender specific because some reproductive diseases might be there which will be present only in the female. You will not think of them in the male. Then some diseases might be there in the males which will not be present in the females. So obviously some reproductive organs are different, so the diseases also will be different in the reproductive organs, and some other diseases also are more prevalent in males than females or vice versa. So you have to know the gender of the patient. So this is that's why the gender is important. And then the address. Now, why the address is important? One thing is for communication of the patient. If the patient can regularly come to you for a follow-up or not, you will have to ask him. Suppose someone has come to stay here for 1 month. So you have to plan that accordingly, that you go outside and show to any other doctor or like that. So you have to know his address. And another thing is important in address that some diseases are more prevalent in some states. Like in our state, in Tripura, malaria is more prevalent than some state like Rajasthan or somewhere else. So in case of a fever patient, we can come to think of malaria. It's like if the symptoms are matching, we can think of okay, the patient might have malaria. But suppose in Delhi or in Rajasthan, we will not think that much about malaria, that the patient may, or the thing will be reduced. That thing thought of malaria will be reduced. We will think of it in less chances. Then occupation. Why the occupation is important? Like in some factory workers, they might be working with some chemicals. So in them, some diseases might be more prevalent, like some respiratory diseases, or someone who is a hard worker, laborer, they may have some set of diseases, they may have some muscular diseases, Then the people who are working in high profile jobs in IT sectors or any these kind of jobs, so that those people might have more cases of anxiety or stress, so which will be less common in some poor people or who are working in different kind of occupations. So that is the importance of the occupation. Then there comes marital status. Obviously you will have to know the marital status of the patient, so because the married people may have some STDs or STIs that are sexually transmitted infections. So you will also think about that. The person is married, you can go in that direction that the person might have a sexually transmitted infection or disease. So the marital status is also important. Then firstly, you will ask about principal symptoms. Everyone is getting that till now, or I am too fast or nothing? Okay, firstly you will ask about principal symptoms. Principal symptom means there might be many problems of any patient. Like someone may have fever, he may have cough, he may have pain abdomen, he may have pain in the leg, itching in his hand, whatever. But he will not come to the doctor for everything. There must be a specific thing for which he is bound to come to the doctor. He cannot tolerate it anymore, so he has to, lastly he has to come here. So it will not be for everything. Like if someone is having severe pain abdomen and someone is having itching in this part of his hand, obviously the patient will come for pain abdomen only, not for itching. So you will ask the principal symptoms. Principal symptom is the main thing for which the patient has come to the doctor. That is the principal symptom with duration, and we will allow the patient to describe. Duration means firstly we will ask that what problem you are having. So suppose someone is telling I am having fever, I am having sore throat, or I am having cough and this and that. Then we will ask for how many days. That will the diagnosis will depend on this one only. Someone having cough for 2 days, 1 day, he might have a simple respiratory infection, upper respiratory infection, or any viral infection. Someone having cough for 2 months, we may think of TB, that the patient might have TB, that's why his cough is not going away for 2 months. So it will depend on the duration also. So with that also we can judge what the patient is having. Then we will tell the patient to describe in his own words. We will not question him, we will just ask him that what are you having, and you describe it. So he will tell, okay, I had fever, the fever I am having from 5 days, it is increasing and decreasing, it is high fever and this and that. He will tell in his own language. Firstly we will allow him to speak by himself. He will tell what problems he is having. Then inquire about the sequence of symptoms and events. Sequence means I have already told you that the patient might have different things. Like he may tell that I am having fever, I had vomiting 3 times, or I had diarrhea 3 times. Then we will ask him what happened first. Firstly you had vomiting, then you had fever, or firstly you had fever, then you started having vomiting, like this. So that we can correlate that the fever is the cause, or another thing is the cause. The infection is the cause, or due to electrolyte imbalance also something may happen. So in that way we can correlate what is the main problem of the condition. So as I already told you that don't ask leading questions at the beginning. We will not start questioning that did you have this, did you have this, that. We will tell the patient you explain by yourself whatever you are having, what problem you are having, you go on explaining, keep on explaining. After the patient stops explaining, he has completed telling everything, then we will question by ourselves to gain more information about the patient. Then firstly this history only. Actually in clinical classes you have to write this. When you are taking a patient's history, you have to write this sequence wise, that firstly chief complaint, then history of present illness, like this. Then what are these things? Chief complaint with duration. Chief complaint is only one complaint only, but you have to write the other complaints. You have to write that firstly you will write sequence wise, that what is the main problem. That someone is having low fever, that not that much, he is having a viral infection, but at the same time he might be having appendicitis or anything, he might be having severe pain abdomen. So you will write the pain abdomen first, pain abdomen, severe chief complaint. Then you will sequence wise write the complaints which are less which are of less importance. We will write that thing in a sequence of events. Then chief complaint you will write your duration, like fever for 3 days, then cough for 2 days, vomiting for 1 day, or loose stool for 1 day. Like this, you will keep on writing the days which are the disease which are occurring for more days with the symptoms. You will write that beforehand. Like whichever occurred first, you will write that first. That the patient first had fever, then he had vomiting, or first he had vomiting, pain of abdomen, then he had fever. For how many days, since when, you should write all these things. We will share this. You don't need to write. We will share this. Then you first concentrate on the class. Then you will write history of present illness. In the chief complaint, you will write only about fever. That fever since these days, only this, not fever only, about any complaint, pain in chest, or pain in this, or anything. You will write about that chest pain. She's sleeping. You are sleeping. Chest pain or fever or this and that for these many days. Then this is the history of present illness. Then we will elaborate that whether the fever was of low grade fever or it was very high grade fever, where the patient was having chills. Chills means he is shaking, and rigor is there. Rigor means the patient is violently shaking and he is sweating also. That is called rigor. So if chills or rigors were associated, or was any headache associated with the fever, we will write that things. History of present illness. In that we will elaborate the complaint for which the patient has come here. We will elaborate that thing in details. Then we will write past history. Okay, present history is gone. Now past history, in past history there will be history of any surgery, any hospital admission. Now why past history is important? Like if the person is having regular fevers, regular interval of fevers, like in last 2 years he had 3 or 5 episodes of same kind of illness, like chest pain. He might say that I am having chest pain since many days. It will go and come. Like after 3 months I am having again. Before 3 months once also I had this kind of complaint. Then we will know that okay, this is a chronic type of pain. This has to be evaluated differently. This will be a different cause. So you have to think in that manner. So in past illness, there will be also history of diabetes or hypertension, or any chronic diseases like kidney disease. So if the patient is having diabetes or hypertension or any kidney disease, you will treat him differently. Because these patients, diabetes, hypertensives and kidney disease patients, they will have more, they will be prone to having more diseases. So you will think in this manner. You will have to ask about the past illness, and if the patient got recently admitted in a hospital, what antibiotics he got, what treatment he got, you have to know everything. Then only you can plan that okay, he is already having this diagnosis, this thing is a repetition or not, or it is a new one. You can know that. Then you will ask about surgery. Like if any person had undergone surgery, suppose someone has got their gallbladder operated, it is already been taken out. So if the person is having pain in this area, in the same area where the gallbladder is there, so we will usually think about the gallbladder only. Then if we come to know that the gallbladder has already been removed, then we will think of something else, that if any other infection has occurred in the surgical site, or is any other organ affected there, or is this any other cause. So that is the importance of the surgical history. For that, sometimes something may happen like that. The one patient has recently undergone surgery in like 1 month or 1.5 months or 15 days. He is having pain in the same area. So if you know only about the surgery, then only you can think that okay, he might be having infection in the surgical site, because the wound was opened, the body was cut down, so there might be some infections in this place. So you should know the surgical history. Then family history. Why family history is important? Because in the family some disease may run. As you know, hemophilia and something else, they might be present in the family. So not only hemophilia, many other diseases like diabetes, hypertension, and many other diseases are found in the family. If we know the family history, then we might be a little bit more sure that the patient is okay, the patient is having hypertension, because the patient will come to me for the first time. First time anyone may have a high blood pressure, so we cannot diagnose him as hypertension in the first time. After seeing me also, his blood pressure may rise. So obviously it happens after going to doctor. Some people due to fear their BP will increase. So that is the importance of the personal history. So the family history. We will have to know the family history of the patient. Then personal and social history. In personal history, you will ask about any abuse he is having, alcohol abuse, any drug abuse, any smoking, tobacco. So these abusers will have different kind of diseases. Like who are alcohol abusers, they will be more prone to the liver diseases. So if someone has come with a liver disease, we will ask him if the person, not only liver disease, if a person has come with symptoms which are relating to liver disease. So you can ask him if you are taking alcohol. If he says, okay, I am taking alcohol for 20 years, like 10 years, then you can be more sure that, okay, he might be having liver disease. If he is not having alcohol, then you will think of something else. Again, if a person is having cough, he has come with breathing difficulty. If he is telling that I am smoking cigarettes since last 30 years with 1 packs per day like this or something else, then we will think of, okay, person might be having respiratory disease. It is called COPD. We will not learn about this now. We can know that, okay, the person's disease might be caused due to his smoking addiction. So likely in that way only. We will ask about the intake of any substance abuses. You will ask about that so that you can be more sure about the diagnosis of the patient. Then you will ask about travel history. Recently everyone might have seen that in anywhere during the COVID season, everyone was asked if they are traveling somewhere else or not. In the flights also, everyone was asking that, did you have any travel history or not? So travel history is important because some diseases are specific to some area, like malaria. Someone here got malaria, someone is from Mumbai or somewhere else. He came here, stayed for 5 days, 10 days. So he got a fever. So after going there, if the doctor asks him that did you travel somewhere, then he will say that I traveled to Tripura. Then the doctor will think that, okay, there might be a chance of malaria because the symptoms are not matching with the local patients. So that is the importance of the travel history. Then you will have to ask for, don't talk. Okay. Then we will have to ask. Okay, fine. Then we will have to ask for pet or animal contact. Like someone is having a respiratory disease, like he is coughing for many days, but he is not getting cured. So he is having cat or dog in his home, or he is allergic. He doesn't know that he is allergic to cat or dog. So he is handling dogs and cats regularly, and his allergy is not getting cured. His cough is not getting cured. You are giving antibiotics after antibiotics, you are giving these different kinds of medicines, but the person is not getting cured. That's when the pet history or the animal contact history will be important. That if the patient tells, okay, I am handling cats, then you tell that, okay, you stay away from cats for few days. Then you may see the patient is cured. So in that way, the animal contact history and pet history is important. Then you should know about the drug history. So what is drug history? Drug means medicines. What medicines he has been taking. Suppose a person is having fever for like 5, 6 or 7 days like that. So we should ask about the drug history, because if we give the same antibiotic to him, already he is taking antibiotic from somewhere else. So you have to ask him, what medicines are you taking? If he comes to me, his fever is not cured and I am giving the same antibiotic, then it is of no use, na? Only his money will be wasted. That will be of no use. That's why drug history is important. And people may be allergic to anything, allergic to drug also. Some people will develop allergies to some tablets, some will not, some will develop. So someone might come with an allergy. So if you ask him that any medicines you are taking, so he might be taking that recently I took amoxicillin or any other drug I am taking. So if you remove the drug, so he might be cured from the disease. So that's why the allergic history is important. And allergic history is not only about drug history. It is the allergy might be also from any food items, any animal handling or anything. Anyone may get dust allergy or pollen allergy, whatever. So you have to know that, to know the allergies, so that you can treat him better. If you don't know the allergies, if he keeps on exposing himself to pollen or dust or anything else, whatever treatment you give, it will not suffice. Once the treatment ends, the patient will again get affected. So that is the importance of the allergy history. So that you can tell the patient that you abstain from these things. You don't take these foods, or you don't go to that environment. You use a mask. So you can tell these things to the patient. So that is the importance of the allergic history. Now there is one example for whatever I have told till now. The case how you will take the history. That is one example. Like in this case, they have used an example of chest pain. Suppose someone has come with a chest pain of 2 months. So this will be the chief complaint. As I have already told you that you will write the chief complaint. Along with that, you will write about the duration. That since how many days the patient is having this problem. So patient is complaining of chest pain since 2 months. So this is the complaint. Alongside you can see the duration. Duration is 2 months. Then after that, history of present illness. In history of present illness, you will elaborate what the disease is. You will describe the disease. So you will ask when the patient was completely well. You will ask him that before 2 months you are completely fine or not, or you are having this since last 1 year or not. He will tell you. Then if the patient tells that no, I am having this problem since 2 months only, then you will know that okay, it is a new kind of disease, something new has developed in his body. So you will treat that accordingly. And if it is a chronic disease, if the patient tells me that no, I used to have this disease since my birth or since I grew up, I was having this every year or every 2 years, then you will treat it differently. So that is the importance of of asking this question. Then you completely well before this. Then you will ask the patient that what happened and describe symptoms in chronological order of onset. Means there might be associated symptoms with it. He might have chest pain along with heartburn or along with indigestion, or he might not have these things. So if he does have these things, then you will have to tell him to describe these symptoms. You will tell him to describe in his own words that tell me what problems you are having. If you are having problem in digestion, taking food and or not. They should be in chronological order. Like, okay, I am having fever since today. I was having cough since 2 weeks. Not like that. Firstly, you will tell that since 2 weeks I am having cough. Then since 1 week or since 1 day I am having fever. Like that. In chronological order, whatever happened first, that should be told first. In the chronological order, it has to be described. There is no the present illness. Then ask for the site of the pain. Site of the pain, look, our chest is this much, na? It is this much big. So this part is also chest, this part is also chest. If he tells me that I have problem in my chest, so then I should look for it. If the problem is in his left side of chest, so obviously it might be correlating to a heart disease. If it is in his right side, then this also might be a heart disease, but it is less, the chances are less. So we will think of something else like muscle mass fatigue or something like that, or indigestion, or muscular stiffness, or any bone pain like costochondritis. Like that might be pain in the ribs. We can think of that also. And if it is on the left side, we might think more of any heart disease. So the site of pain is important, or especially in abdomen pain, obviously, because the abdomen is divided into 9 parts. So in that different organs are there. So if the person complains of pain, he just tells me that there is pain in the abdomen. I will not be sure that what problem he is referring to. He has to localize the pain. Then only I can think of the organs which are present in this place, and then only I can start my treatment in that way. That okay, this I should start examination of this. I should look for this. Then only I can be sure. Then there is acute or gradual. Acute, what do you mean by acute? Someone tell one. Short term, okay. Something like since today only I am having pain. That is called acute. Short term pain or short term anything. This is called acute. And what is gradual? It is built up by time, with time. Like say before 1 week I was having pain, but it was less in compared to today. It is increasing day by day. So that is called gradual pain. Means before 2 weeks he couldn't tell that he is having so much of pain, and gradually he had to come to the doctor. And in acute pain, the pain will be so much that you will have to press your abdomen and sit down, and then you have to go to the emergency like this. That is called acute pain, and that is called gradual pain, which is slowly it is increasing. Then you should know the character. You should feel the character of the pain, or you should ask the character of the pain. Like pain are of different types. Like for example, feeling pressure. Feeling pressure means in myocardial infarction, when the blood supply to the heart is compromised, then there will be sense of feeling of pressure in your chest. Like you will feel that someone has sat down in your chest, or someone is pressing in your chest like this. This is with the pressure. This is called feeling of pressure. That is a different kind of pain. And there may be dull pain. Dull pain means the pain is there, but you cannot localize it so much, and the pain is everywhere. It is all over the chest, and it is not that much that you are not able to work, or you are not. It is bothering you, but not that much that you are forced to come to the doctor, or like something like that. It is not that much severe. So you are having dull pain since like 5-6 days. At the end of 6 days, you came to the doctor. Obviously, because you are having less pain, that's why you are concerned now only. So that is called dull pain. One is stabbing, one is shooting. Stabbing means that if someone stabs you with a knife, or someone pokes you with a pen, that is called stabbing pain. So in some cases there might be stabbing pain. That there is no pain. Suddenly there will be a prick like this. You cannot tolerate it. It is acute kind of pain and it is very severe. So that is stabbing and shooting kind of pain. Shooting is also similar pain. There will be some severe, someone is punching you like that. That will be a stabbing or shooting type of pain. So it is of severe character and it is relatively of acute character. Then there is radiation of pain. Now in the next slide I have shown it. What is radiating pain? Radiating pain means, like listen this carefully. You are having radiating pain means like in myocardial infarction. It is a kind of radiating pain. You are having pain in the chest, left side of chest. You might also be having pain in the left arm, in this left arm. So you are consecutively having the pain in your chest and also in the arm together. You can feel it in the chest also, in the arm also. This is called radiating pain. Means it is present at both of the sides together. Or together they are present. So it is radiating pain. Like in myocardial infarction, as I already told you, there will be pain in the left side of chest and there will be pain in the left arm. So in both places you are feeling the pain together. And in acute pancreatitis also, the pain will be felt in the back, lower back. The pain will shift to the lower back. So not shift actually, it will radiate. This is called radiation. Shifting is another thing. This is called radiating pain. So you will feel the pain both in the abdomen and in the back, in the lower back. Together you are feeling the pain. That is called radiating pain. There is another kind of pain which is called Rapport pain. Like in cholecystitis, inflammation of the gallbladder. You go to the gallbladder, na? You have been taught about the gallbladder in anatomy or not? Not taught. Okay. Inflammation of the gallbladder is called cholecystitis. So if there is inflammation of the gallbladder, sometimes people will not feel the pain where the gallbladder is. They will feel the pain in the right shoulder. This is due to nerve innervation. The same nerve is supplying both areas. That's why the pain is felt in the upper shoulder, in the right shoulder or in between the shoulders. It may be sometimes be felt. So it is a kind of Rapport pain. So in case of any patient, if any patient is telling that I am having shoulder pain and you are giving muscle relaxants, then obviously it will not work. The pain may reduce, but again after 1 day or after 6 hours, 7 hours, again the pain will be there. So you have to think about it that okay, the patient is having the pain in the right shoulder. That might be a case of cholecystitis. So you should think in that way also. Then there is also another type of pain, radicular pain. So, which is caused by compression of spinal nerve root. Like when in old people, you may have seen that old people are sometimes complaining of pain or numbness in one leg, one whole, like in right lower limb or left lower limb, or they may tell you that there is a shock-like feeling, or someone is pricking like that. There are some feelings like that. So he is having pain either in the left lower limb or the right lower limb. But the main problem is his nerve. If you treat his legs, then the pain will not go. Because due to the compression of the spinal nerves, when the spine gets degenerated due to old age, and the fluid in between the spine gets reduced, so then the nerves will be compressed. Due to compression of the nerve here, you will feel the pain in the legs, but the problem is in your back. So that is a kind of radicular pain. So there are 3 types of pain: radiating pain, Rapport pain, and radicular pain. Till now, anyone is having any problems? Anyone not able to understand anything? Okay. Then we will ask about the severity of the pain. Once we know the pain, where the pain is, how the pain is, we will know that if the pain is too much or you are able to bear the pain. In that, after knowing this, we can treat it accordingly. Like severity, it is interfering with the work or sleep. Like someone might be having abdominal pain, mild abdominal pain, he will come with that to the college. And someone is having so much pain that he is not even able to wake up from his bed. In that case, he will not come to the college or his work. So that is a severe kind of pain. By that, we will know that the patient is not able to do his regular works. So we will ask about the work pattern, the pain, if it is interfering with his work or his sleep. Suppose the patient is telling you that I am not able to sleep at night due to my pain. So that is also a severe kind of pain. That's why he is not able to sleep. So, and there is precipitating or relieving factors. Precipitating is if something is increasing the disease, like you are having chest pain, someone is having chest pain, like from heart disease. So if he is already having heart disease and he is exercising, so obviously his pain will increase, or he is, suppose he is having pain in his abdomen. So sometimes what happens that some abdominal pain, after taking food, they will decrease or increase. Like someone will say that after taking water, I am having pain in my abdomen, or after taking food, I am having pain in my abdomen. Or someone will say that there is pain when I am in empty stomach. When I take food, the pain will go away. So that is the precipitating or relieving factor. Precipitating is something which will increase the symptoms, increase the severity of the symptoms. It's like if you are having, someone is having ischemia, or there is reduced supply to the blood supply to the heart. In that case, if the person gets excited, if he gets nervous, or if he is running or doing something, then his problems will increase. And relieving factor means if the same person is resting, he is not thinking of anything, he is sleeping, then obviously he will not have pain in his chest. He will not be, the disease will be relieved. This is called known as relieving factor. The things which reduce the intensity of the conditions. Then history of this pain before. I have already told you that if you will ask the person that if you are having this pain from earlier also, that if a person tells me that I am having pain in my chest from today, I just walked out or I carried heavy bricks like that, then I will also think that the person may have some muscular disease or some muscular due to strain, muscular strain also, this thing may occur. And if the person will say, no, I am having this pain since last 1 year or 2 years, every 2 weeks, 3 weeks I am having this pain after doing heavy work, then I will think of, okay, this person might have some heart disease, some ischemia. So that is the requirement of the history of this pain. Or not only pain, someone may have some other disease, like he may have some vomiting tendency. You will ask him that did you have this vomiting tendency before also? He will tell, okay, I am having this problem. Then you will treat it in a different scenario, in a different manner. Then there may be associated pain, like in angina. As I have already told you that some heart diseases will get precipitated due to some conditions. Like someone is having muscle strain. Again, I am giving the same example. Like if you are lifting weights, you are having pain in your muscles like that. Or if you are chest pressing, you are having pain in your chest or muscles. So obviously, due to sweating or nausea, you will not have sweating or nausea due to that. If you are sitting in your room after your workout, after 5 or 6 hours, you will not have sweating if you are sitting in a normal room, and you will not have nausea. But in angina, what will happen? There will be associated nausea or associated sweating with the pain. Whenever there is pain, we will, in normal environment also, other people are not sweating, but you are sweating. You are having vomiting like symptoms. Nausea is not vomiting. It is the feeling of vomiting. I am feeling like I will vomit, but I am not vomiting. That is called nausea. So you might feel that you are having nausea. Not feel that the patient will tell that I am having nausea and sweating with the pain, with the chest pain. Then you might think that, okay, this is not a normal pain, it might be a pain of the heart or something else. So this is the importance of history. So sometimes these things are for patients. Till now what I have told you, these are applicable for everyone. But till now I was talking to the patient. himself, the patient directly or himself or herself, she is talking to me or he is talking to me, OPD patient. But in emergencies, what you will see, someone has collapsed, someone has fall from a 3-story building, or someone has been hit by a car or a train, he is unconscious. So basically we cannot ask that patient that give you history. The patient cannot give his history. In that case, we have to know the history from others. So from whom we will take the history? Everyone is attendant, but whoever is accompanying the patient, he is the attendant of the patient. But it should be the relative is preferred. The relative of the patient who is staying with him in his home, or who is his near relative. The nearest relative is the most reliable person. That person should be reliable. Otherwise, if he is staying there, someone from his neighborhood is coming to give his history, that will not be reliable. Nah? He cannot tell everything. Maybe the details of the accident, we can know that he has been hit by a bus, or he was standing there, the bus hit him, or he was driving a motorcycle, riding a motorcycle, like that. Until this, we can learn from the bystanders. But we cannot learn everything, like is he diabetic, is he taking any medicines, or if he is taking any blood thinners. In that case also we will treat differently. If the person is taking any blood thinners, then the bleeding will be more. Then we have to ask this to any relative, whoever is knowing about his medication, who is knowing about his lifestyle. That people, bystanders will not know if he is alcoholic or not. The alcoholic breath is a different thing, or if he is taking any tobacco or anything else, any substance abuse, that people will not know. And in case of children, you will see in the pediatric ward, in case of children, the most reliable one is the mother. You will ask the mother only. Mother will know best. If you ask the father may not be able to tell everything. So these are the things we have to be careful of. The attendant, which we are asking, he should be reliable. Someone comes to visit him after 1 year, after each 1 year, we are asking him his history. Obviously, he cannot tell me. So that is important. So again, I have told you in the previous slides, the previous illness or hospital admission, the same illness he is having, or same kind of illness which is triggering this condition. Like someone is having epilepsy. Someone is having epilepsy, during driving he suddenly collapsed, means he had an accident. So that is not caused due to any other thing. This is caused due to epilepsy. Only if you know that the patient is having epilepsy, then we can think that okay, during driving he might have had an attack of epilepsy. So the history is important in this way. So also the hospital admission, as I already told you, if the patient got admitted with similar complaints or any other complaints, you have to ask them. Again, operations and the medicines, I have already discussed these points. Then family history. In family history, we will ask these things: father and mother, then hypertension, diabetes. Then this is important: history of death. Like suppose one person is of 40 years is coming to you with a chest pain, left sided chest pain. If you ask him that did your like his father has died, his father or his mother or any close relative, his elder brother of 60 years or 70 years, he has died due to heart attack. So in that case, history of death is there. If any history of death is there, you can be little bit more sure that the patient might be having a heart disease, for which already his family member has died. So he is also carrying the same problem. So he is also more prone to death due to heart disease. Then how many brothers and sisters do you have, or how many relatives do you have? Relative means close relatives. We will not ask about your aunt who got married to someone else, not like this. Not like you will ask the immediate family, like him, his mother, his father, his sister, brother. So they are having the same set of genes, na? More likely they are having the same set of genes. So we will ask them only. Then ask about his job, his marital status. I've already told you. Some people who are in high-profile jobs, who are working with computers, or in very tiring jobs, they might have some stress-related disease which might cause a heart attack or something else. So these things are important. How many children? As I told you that the immediate family is important. Smoker. Okay, if the patient is old, we will ask him whether you are staying ground floors or you are staying upstairs. If the patient is old and if the patient is having pain in his knees, or if the patient is having angina, like chest pain which increases on workout or on exercise or on doing any hard work. So in that case, if the patient is living upstairs, the patient will have more chance of getting aggravating the disease. So aggravating means increasing of the disease. If the patient is living upstairs, obviously he will have more chances of getting another acute attack of this ischemia, this ischemia attack. So in that case, we will ask if he is living ground ground floors or upstairs. Then we will ask the patient if he is having any difficulty. Like someone has, we will always ask the relevant questions to the patients. Not that we will ask everything to every patient. Not like that. Because if someone comes with chest pain, he is having heart attack. In that case, rarely we will ask that, do you have any pet? Are you having kittens or you are having cats? Obviously, we will not ask that. So that should be relevant. Like if some patient is coming with chest pain, he tells me that whenever I am working or I am working with normal people, I get distressed very easily. I am tired very easily. Then we will ask him that are you having any difficulty while you are going to toilet, while you are cooking, while you are shopping? Because these things are normal for us, for everyone of us. If you are going slowly, if you are going to the toilet, then if you are going to the toilet, if you are normally walking or normally cooking, then we don't feel tired. But if someone gets too much tired, that during cooking also he has to sit by pressing his chest, he has to sit down, he is so much tired, or during going to bathroom also he gets fatigued. So that is a sign of a heart disease, or a lung disease might be there, respiratory disease might be there. So these things are important. We should ask the patient that if normal tasks are heavy for him. So these things will lead to a diagnosis of any heart disease. Then after asking all these things, then we will complete the history. Then we will start the general examination and the systemic examination. The history is very important because in some places, in cities or big towns, people may get available facilities of everything. You can do a CT scan, you can do a MRI, whatever you want. But in rural areas, you will see that people are not acquainted to this, and they don't have the money to do these tests. Like if you are doing a MRI for a simple reason, someone is having a normal pain in his stomach, in his abdomen, and you are subscribing and you are suggesting an MRI for this treatment. So obviously the patient cannot do, and he will not take treatment. So in these cases, history is very important. By history only you can know half of the disease. Then you can treat accordingly. You will do only one test, one or two tests. After that, you will come to the diagnosis. That's why the history is important. After the history, we will go to the general examination. In general examination, we will try to do all of the patients. Then systemic examination. Systemic examination means any particular system of the body we will examine. That will be depending on the general examination and the history of the patient. Like he is having breathing difficulty, then obviously we will check the lungs and the heart first, then only the other organs. We will give the emphasis based on the history. So that is the importance of the history. Now, sir will take another part.